My name is Deirdre Siddaway, Respiratory Nurse Specialist in Primary Care working in Ipswich, Suffolk, and also committee member with the Association of Respiratory Nurse Specialists. We're going to look at the things that we must remember in order to provide a quality, structured asthma review. The acronym SIMPLE was devised by Dermot Ryan and Anna Murphy, and this leads us through the things that we must remember. There is also an app available which you can download, and that's called Asthma Made Simple. The S is for stop smoking. Nearly half of all smokers who die from smoking-related diseases. Nurses are in an ideal role to make every contact count. We must ask the patients about their smoking, advise them about the benefits of stopping smoking, and then refer them to an NHS stop smoking clinic. The I is for inhaler technique, and this varies depending upon whether it is a meterised pressure device or a dry powder device, and we're going to look at those in part 3. You can look at the asthma.org.uk website to see how to use these inhalers, but very briefly, pressurised meter devices require a long, slow inhalation, where dry powder devices require an inhalation that is fast from the start. The M is for monitoring. This is both by the patient to aid self-management and also by us. We must ask the RCP 3 questions, that's symptoms, day, night or activity, measure peak flow. We can use the asthma control test or the carrot test to help to assess allergic rhinitis, and we're going to look at these in much more detail in part 2. The P is for pharmacotherapy, and we're going to cover this in part 4. But it's important to remember before stepping up, think CTT. That's compliance, are they using their inhaler? Technique, are they using it correctly? And the other T is triggers, is there anything that's making the asthma worse that we should address? Remember to consider stepping down treatment where appropriate, and we're going to talk about that in part 5. The L is for lifestyle. Think about diet and exercise and weight management. Consider whether there may be comorbidities which are affecting or contributing to the asthma, such as eczema, reflux or rhinitis. And also consider social and psychological factors which may be contributing to the asthma. E is for education. We must educate the patients about their condition, their medication, how and when to use it. We must give patients personal asthma action plans, and we're going to talk about those in part 6. And we must talk to patients about self-monitoring, what they need to do in an emergency, and how they need to get help. We should also think about giving patients other places to get information from, for example, different websites. The Asthma UK website or the British Lung Foundation website are great places for patients to get more information about their condition.